a community in mourning.
Hearing of his passing, it was sad, and especially knowing that he's got a young family.
Just hearing about the circumstances behind him just kind of adds to the sadness.
At just the young age of 26, the Fond du Lac Police Department says Officer Joseph Kurer lost his battle with COVID-19. The department says all evidence indicates that Kurer contracted COVID-19 while on duty, so his death is being treated as a line of duty death.
I knew they had a police officer who had been ill and it was fighting COVID. Certainly, we didn't have a lot of information because these matters are private. But we remained hopeful as a fire department that better days were going to be ahead for him.
Fond du Lac Fire Rescue Chief Peter O'Leary believes Kurer had been hospitalized for about 6 weeks. Officer Kurer's death is the second COVID-19 law enforcement line of duty death in the state of Wisconsin. It's unclear if Kurer was vaccinated or not. The Fond du Lac Police Department says, out of respect for Kurer and his family, they don't disclose that information. But the community still hurts over the loss of one of their own, and they're more concerned about honoring the officer. Officers could be seen out here making a memorial on top of this squad car and even switched out the numbers on it to match Officer Kurer's badge. Wednesday night, a law enforcement procession escorted Officer Kurer from the hospital to the funeral home.
To see how precious life is and how quickly it can be taken away, I really feel for those who are left behind, because that's a big gap.
Officer Kurer left behind a wife and 2 children, his second child, born the night before he died.
I pray for his family, his wife, his new baby, and for the whole department.
In our region, we've seen a tripling, quadrupling of the number of cases in the last several days. That has resulted in a tremendous amount of hospitalizations, as we've talked about before, and there are very few beds left.
Theta Care says 90% of those being treated for COVID-19 in Fox Valley hospitals are unvaccinated.
It's a younger population. The average age is between 40 and 50. Whereas in previous surges, it was primarily in the elderly population.
Ascension Fox Valley Chief Medical Officer Tom Nichols says this population is also sicker.
They've been in the hospital longer and they're requiring more resources. And nearly all the hospitalizations are preventable.
Nichols says many say the same thing.
Most of the people that we talk to that are in the hospital that are very sick, they all say the same thing. They say, I wish I would have gotten the shot. I wish I would have listened.
Healthcare organizations continue to push Wisconsinites to get the vaccine.
Our ask today, as we have done before, is for the community to really get activated in terms of the immunization rates and what we can all do together to make sure that we use the tools in our toolbox.
The vaccines are safe. They are effective.
And to continue using other mitigation strategies.
The messages around wearing a mask and social distancing and avoiding crowds all still hold true. But really, if we want us to be able to get through this pandemic as a community, it's going to come through vaccination.
Well, let's start there. What are the numbers like at area hospitals for children, those under 18?
Right. So, of course, as expected, children seem to represent the minority of the number of patients in the hospital with COVID-19. Less than 1% of kids less than 18 years old end up needing to be hospitalized due to COVID-19. We do know that there is a syndrome called MIS-C, M-I-S-C, that actually comes 4 to 6 weeks after kids are infected with COVID-19. And with this recent increase in cases, we are expecting that we may start to see more of those cases here locally, which can be quite severe and really impactful to children's lives. But again, relatively low numbers of children who end up landing themselves in the hospital with COVID-19.
What advice do you have for schools and parents to keep students safe?
So the evidence is clear behind masking at this point, especially if kids are going to be closer than 6 feet from each other for an extended duration of time. Masking is a key public health measure to mitigate the impact that COVID-19 is going to have on schools. That includes new cases, needing kids to quarantine due to cases, and school being let out due to a high number of COVID-19 cases. So masking is a clear thing that we need to be doing at this point, particularly with the high number of circulating COVID-19 cases throughout our entire community. Of course, vaccinating for those who are eligible, who are currently 12 or older, is very helpful. And of course, for teachers and other staff that interact with students. And then probably most importantly right now, if a kid is sick, has a fever, cough, sore throat, loss of taste or smell, or any potentially infectious symptoms, parents should really be seeking a test for COVID-19 at this point and keeping their kid out of school until we know that it is not COVID-19, because we just cannot have that spreading throughout our school right now.
Are you noticing more children with COVID who are unvaccinated, those who are under 12 and don't have the chance yet?
We've noticed a significant increase in children who are infected with COVID-19. We have more emergency department visits from that age group. And in some areas of Wisconsin, they're reporting that upwards of 1 in 3 cases of COVID-19 now are children less than 18 years old.
Now, Pfizer says its vaccine is safe for those between 5 and 11 years old. What's the time frame for when that age group might be able to start getting shots?
So we'd expect rollout for that probably to happen sometime around Halloween or perhaps a little bit later into November. But clearly that date is coming up here very soon. And of course, your health systems are all getting ready to try to figure out exactly how we're going to do that rollout best.
And Johnson & Johnson's now saying adding a second dose of its vaccine provides 94% protection. Do you think a second dose will be needed for people who got the J&J?
So the J&J vaccine continues to be highly effective at preventing COVID-19 altogether, preventing hospitalization, and preventing death. So it continues to be an effective vaccine for anyone who may have received that vaccine. Of course, if we give a second dose, a booster dose, it's going to boost up people's immune systems, and exactly which people are going to be best served by getting a booster shot of Johnson & Johnson, I think needs to be teased out a little bit. I would anticipate it's going to be months before that data is available and considered by the FDA and then the CDC.
So is it too early to tell when someone should get that shot?
I think it's definitely probably too early to tell. Though at any time they may push out a study that someone is doing that I'm not currently aware of. It's hard to keep up with all the literature that is coming out on COVID-19 that might make that happen a little bit sooner, but I think it's probably a little bit ways out yet. But people, again, should have confidence if they receive that vaccine that it continues to offer a significant protective factor, and they made a good choice by getting vaccinated.
CDC leaders have been meeting this week to talk about boosters. What are you expecting to hear from them?
So yesterday, the FDA approved using the booster shot for individuals over 65 or people under 65 who have high-risk medical conditions or due to their occupation are frequently exposed to COVID-19. The CDC's ACIP committee is meeting, it sounds like today, and we should hear information very soon from them about whether or not they would agree with this recommendation made by the FDA. So this should happen very soon, probably before the news this evening.
Let's talk locally a bit. How full are local hospitals this week? Are beds available?
So bed space continues to be very tight across our entire region. Emergency rooms continue to be extraordinarily busy with record number of individuals seeking emergency care. So for people who do feel that they have an emergency and need to go to the emergency department, we again just encourage people to be patient, try to be respectful. We know that it's a stressful period of time, but yelling does not help the situation at all. And then, of course, if you have a question about your health care, you're not sure if you need to go to the emergency department, all the health systems have telenurses who are available to take your call and help screen you to figure out where the best place for you is to get your care. Is that the emergency department? Is it urgent care? Or is it via your primary care doctor? So again, just urge people to be patient as we work through this increasing number of cases across our entire region.
So emotions are still high when it comes to getting care in hospitals. You mentioned yelling. Is it getting any better?
I think the last few weeks probably have been the most stressful for anyone in healthcare or particularly in emergency departments. You know, I think staff is sort of getting burned through relatively quickly right now. It's been very, very busy. There's no time to take even a couple of minutes for yourself. And, all of our people are really dedicated to the entire community, trying to get people seen and sort of running around to get things managed. But, I think we are doing well at this point. We're taking care of people safely. And when you check into the emergency department, you are triaged by a nurse who determines if you need to be seen immediately, if you can wait a few minutes, or potentially can you wait a few hours and be seen when the next room is available.
Oh, well, here's hoping it gets better for the healthcare workers. So what are you hearing about how severe the flu season could be? And is it too soon to get a flu shot?
It is definitely not soon to get a flu shot. I am working on getting my appointment to get my flu shot just as soon as I can. The flu season, it may be a bad flu season. I don't have a crystal ball. We'll see what things look like. We know that in previous years, when the previous year's flu season has been relatively quiet, we seem to have a blockbuster flu season the next year where it's very, very busy. And as most people probably know, last year influenza was almost non-existent. Despite us doing a lot of testing for it, people just were not coming in with influenza. So if that trend continues, we anticipate this might be a busy year with influenza, but of course that remains to be seen.